Good morning everyone and welcome to our Cabinet meeting. I'm Councillor Simon Hennig, Leader of Durham County Council and Chair of this meeting. This meeting is taking place on Wednesday the 21st of April 2021 and is being recorded live to the Council's website and will be available to be viewed for a minimum of 6 months. Please be aware that any footage from the meeting can be used in subsequent media broadcasts. Before we begin, this is one of the few member meetings we've held since His Royal Highness the Duke of Edinburgh passed away. Although his funeral was on Saturday, I would like to invite members and participants in joining me in observing a minute's silence in memory of His Royal Highness. Thank you. I would like to give a warm welcome to members, officers and any members of the public or media who are watching this live feed of the meeting. Everyone is aware of the housekeeping rules for us all to follow, I think, to ensure the meeting runs as efficiently as possible. However, please note that if I lose my connection, Councillor Alan Napier, Deputy Leader of the Council, will take over in my absence until connection is restored. I can confirm that we've received no apologies and all members of the Cabinet are present. So if we can move on to the items for the Cabinet agenda. Item 1 is public questions. I understand that no questions were submitted in advance of the meeting. In accordance with procedure rules, therefore, there are no questions for this part of the meeting. Item 2, minutes. Can I have a mover and seconder, please, for the minutes of the 17th of March 2021 meeting?
Move the minutes, Chairman.
Thank you, Councillor Napier.
Second minutes, Chairman.
Thank you, Councillor Hobbles. If we can agree that the minutes then are a correct record, if there's any dissent, please indicate that through the chat function.
Agreed.
Thank you. No indications have been received, so I can confirm that the minutes are agreed. Item 3, declarations of interest. Are there any declarations of interest from members, please?
No.
If not, thank you. We'll move on. Item 4, proposal to amalgamate Oxclose Primary and Oxclose Nursery schools into one primary school in a replacement new build on the Durham Roadside of the former Grange Comprehensive School from the 1st of September 2024. If I can ask John Pearce, Corporate Director of Children and Young People's Services, to present the report, please.
Thank you, Chair. So this report seeks approval to amalgamate Oxclose Primary and Oxclose Nursery schools into a single school, with the proposal that there will be a new build on the site of the former Grange school. Oxclose Primary and Oxclose Nursery schools formed the Oxclose Federation in November 2018. This arrangement has worked well and gives a really strong foundation for the two schools to come together further. Funding for a new build primary school to replace the current schools has previously been agreed by Council through the medium-term financial plan. An options appraisal looked at a number of potential sites for the new build, and the site of the former Grange Comprehensive School on Durham Road, Spennymoor, was identified as the best option. An initial consultation was carried out on the proposals between 2nd of November and 13th of December 2020, and this included consultation with governors, staff, parents and the wider community. A total of 118 responses were received to that consultation. 49 of those responses supported the proposal, 69 did not support the proposal. And further information on the consultation and the detail of that is included in paragraphs 15 to 19 of the report. Although more responses opposed than supported the proposal, the main issues that were raised by those opposing the proposal were about the site rather than the educational objectives of the proposal itself. The reasons for moving on to the statutory representation period are described in the report in paragraphs 20 and 21. A statutory notice was then published on the 28th of January 2021 at the start of a 4-week representation period. During this representation period, 32 responses were received. 21 of those supported the proposal, 10 did not support the proposal, and 1 supported the amalgamation but not the proposed location of the new school. Information on the responses received during the statutory representation period are described in paragraphs 23 to 30 of the report, and in line with the statutory guidance for school proposals of this type, a range of factors must be considered by Cabinet as decision maker. Those factors are covered in paragraphs 34 to 45 of the report with relevant information included. The recommendation to Cabinet is set out in paragraph 9. Thank you, Chair.
Thank you very much, John. Councillor Gunn.
Thank you, Chair. I'm pleased to propose this report, which asks Cabinet to support the decision to amalgamate 2 schools in Spennymoor into 1 primary school on a new site and with the benefit of a replacement new build. The report outlines the close working relationship that has developed between the 2 schools, both with recognised good educational standards, through federation in 2018 to the proposed amalgamation. The need to increase capacity to meet the growth in demand for primary places in the Spennymoor area means that a new build school with additional places offers a timely solution. The significant growth via housing developments has put pressure on school places across the town in recent years. And to respond to this, some of the schools in the area have expanded. Ox Close Primary School was one of those schools, but despite this, without further expansion, it cannot meet the demand for places moving forward. I believe that the proposed school amalgamation and new build presents a remarkable opportunity for pupils, parents, staff, school leaders, and the community in general. The primary school is always significantly oversubscribed, despite the expansion it was given 5 years ago. And the demand for school places in Spennymoor will increase dramatically over the next 10 years. Unfortunately, expansion on the current site is just not viable, and previous plans to do this were dismissed on the grounds of access and traffic. Even a relatively small extension, such as the one in 2016, was subject to a strict travel plan. Consequently, the proposed amalgamation in an expanded new build is the best option for relieving the pressure on school places in Spennymoor. The proposal emphasises the Council's priority to invest in education so that children and young people have the best possible start in life to fulfil their potential. The report details the consultation undertaken by the Council on the proposal to amalgamate the 2 schools and the responses received to that consultation. There was a good level of response to the initial consultation, with 118 responses received. Although 69 of those responses did not support the proposal, these focused on the proposed location and site for the replacement new build, rather than the educational benefits of bringing together Ox Close Nursery and Ox Close Primary Schools into 1 single primary school. The majority of those who responded to the statutory notice, 21 out of 31 responses, supported the proposal. I recommend the report to Cabinet and asks Cabinet to agree. Thank you, Chair.
Thank you, Councillor Gunn. And if we can have a seconder to the reports, please.
Councillor Hovels, Member for Health, Chairman. As Councillor Gunner stated, this proposal provides a solution to the pressure on primary school places across Spennymoor, and also gives an opportunity for the fabulous new build facility to be in place to benefit the children and the families in the area. Investment of over 13 million shows the Council's commitment to improving the life chances of young people. The new build school will create a unique learning environment on a new site and offers fabulous new facilities such as sports to the community at large. The responses to the consultation did not lead to any other options being proposed, and I believe the proposal is the best way of providing sufficient primary school places across the area and to provide an effective curriculum for the children, for the community and the school serves. This proposed addresses the issue of school places and offers an exciting opportunity on many levels. I'm therefore happy to second the report and the decision. It asks the Cabinet to agree. Chair.
Thank you very much, Councillor Hovels. Can I ask if there's anyone else wishing to speak, please? If not, if we can then turn to the report and recommendations which have been moved and seconded. As ever, if there's any dissent, can you please indicate that through the chat function, please? Can I ask if the recommendations are agreed?
Agreed.
Agreed.
Thank you. And there are no indications in the chat function, so I can therefore confirm that the report is agreed. Thank you. If we now move on to item 5, high needs block funding for SEND and inclusion support. Again, if I can ask John Pearce, Corporate Director of Children and Young People's Services, to present the report.
Thank you, Chair. So the purpose of this report is to update Cabinet on spend and pressures against the high needs block of the Dedicated Schools grant. This grant is used to support pupils with special educational needs and disabilities. As previously reported to Cabinet, there were significant pressures on the high needs block funding, and in recent years there's been insufficient resources within the grant received from government to meet the needs of children within the county. A combination of factors has led to a very substantial increase in the number of children and young people requiring additional support from high needs block funding since the 2014 Children and Families Act. This was followed by significant reforms to the SEND system and changes to the Code of Practice, which expanded the remit of the Code of Practice and led to significant growth in the numbers of children and young people accessing high needs block funding. The Council previously used General Fund to partially offset the shortfall in high needs block funding. However, the cumulative deficit in high needs block has still grown to 5.7 million by the end of the 2019-20 financial year. Changes in government guidance now mean that the Council is no longer able to subsidise or to cross-fund into the high needs block from General Fund, and that route is no longer open to us. Additional funding was allocated in 2020-21 on a one-year basis, and we have started to see the impact of the sustainability programme implemented following approval by Cabinet last year. However, despite this, spending will still exceed the grant by about 1.8 million in the 2020-21 financial year. There are two areas that continue to place significant pressure on the budget in 2021, those being top-up funding, particularly in primary and special schools, and also the use of alternative provision and the number of places accessed within alternative provision. Appendix 2 gives the breakdown of the projected position against each budget line with details against each area of spend. The sustainability plan for the high needs block sets out an extensive programme of activity with the aim of bringing expenditure back within budget within the 5-year period of the financial plan, which is set out in paragraphs 29 to 32 of this report. The sustainability plan is based on 9 very detailed work streams that were established following a major consultation exercise and previously reported and approved through Cabinet. The main body of the report, going from paragraphs 37 to 102, give an update on progress against each of these 9 work streams and provide detailed information on progress against each of them. There's very strong governance in place through the Centre and Inclusion Resources Board that continues to meet on a monthly basis to monitor the high needs block spend and also progress against the sustainability plan. There continue to be a number of risks which are highlighted in paragraph 35 of the report. I think in particular there is likely to be significant ongoing impact from the pandemic, and we're yet to see the major fallout of that within this area of activity. We're also awaiting the outcome of the national review of special educational needs and disabilities, and that is needed to address some of the systemic issues created by the current legislation and statutory guidance. All councils across the country are seeing the same challenges that we are in County Durham, and the national review is required to tackle some of those underlying challenges. The recommendation to Cabinet is set out in paragraph 9 of the report. Thank you, Chair.
Thank you, John. Again, can I ask Councillor Olwyn-Gunn to speak, please?
Thank you, Chair. Councillor Olwyn-Gunn, Cabinet Member for Children and Young People's Services. Chair, last summer we were called that Cabinet looked at the position with the high needs block and also welcomed the report regarding our special educational needs disability inspection revisit findings and the progress we had made. This latest report updates us on the position with the high needs block funding and the range of projects we are taking forward to try and make the resources as sustainable as possible within the constraints of the funding given to us by the Department for Education. This is a complex area of children and young people's services. Around 1 in 6 of our young people have a recognised special educational need or disability, and some of our children and young people rely on a range of specialist support services to help them with their needs. We've recognised the growing demands on our services within the Council, and we were pleased to be able to include additional Durham County Council resources for the Special Educational Needs Disability Casework Team, business support and educational psychology in the budget we set in February. Recruitment to the additional permanent posts we supported is now taking place. For the year ahead, I have cautiously welcomed the additional funding from the government into the high needs block. But as the corporate director has outlined, the longer term position is unclear. Also, the government's review of special educational needs was due to be published in the spring, and we haven't seen it yet. And this may have significant impact for how we work in the future. Cabinet colleagues will be aware that I've written to the Secretary of State on a number of occasions about special educational needs, disability and school funding. And in my letter at the end of last summer, I also made a number of points about the special educational needs review. This is crucial. I received a response from the Minister in the autumn and was assured that the various points I raised were passed on to the relevant officials in the department. I hope that we can see the outcome of those various points I raised in a positive light. We continue to be challenged to meet needs within the resources available to us. The latest forecast in the report indicates that spending will exceed high needs block grant by 1.9 million in 2020-21. Increasing the deficit position from 5.7 million to 7.6. Whilst this represents an overspend position, the amount by which we are overspending is reducing compared to recent years where overspends were higher. Our current year overspend position is largely the result of a significant increase in demand for top-up funding in mainstream primary and secondary schools and special schools to help resource additional needs presented over the year. The report outlines how we are making progress with our transformation projects, despite the COVID challenge posed to our services, education providers, and our health partners. This progress is bringing about a more sustainable use of funding, bringing spending in line with the 5-year plan, developing practice and provision in the county, and helping to improve outcomes for County Durham's children and young people. Helping our children and young people in the county with complex needs has been a real challenge over the last year due to COVID and the various restrictions and school closures that have been in place at different times. Education providers and staff in our services have worked tirelessly to try and support young people and their families throughout this period, and we are aware that there may be further support needs for some young people in the coming months and years. This may further impact on our high needs block resources, and I am keen to ensure the government gives full consideration of this when looking at future budgets. I welcome the progress this report outlines, the plans for further work in coming months, and the updated 5-year financial plan, which seeks to help us address the deficit which has built up to date. I also commend all of our staff in our services, our education providers, who, as I've said earlier, have worked tirelessly to support our children and young people and their families. I support all of the recommendations in the report, and I would like to ensure that this remains a priority for County Durham after the local elections. Chair, I recommend the report and ask Cabinet to agree it.
Thank you, Councillor Gunn. If we can now have a seconder to the report, Councillor Napier.
Thank you, Chairman. Morning, everyone. I'm Alan Napier, Deputy Leader of the Council. I also have the finance portfolio in the Cabinet. Chairman, I would like to commend the officers for what is once again a very comprehensive and thorough report. There is clearly a tremendous amount of work ongoing in this area. The report very clearly sets out the financial challenges we have faced when dealing with a chronic underinvestment in this area over a number of years. It is not a challenge unique to Durham, and across the country we see the same issues with this area of the budget. Members will recall that in the current year we have invested an additional £1 million in additional staffing within the SEND team to bolster the resources and increase capacity to deal with the increased caseloads and complexity of the cases we are facing. In 2021, the in-year shortfall in the high needs DSG funding is estimated to be around 1.9 million, and by the 31st of March 2021, we will have amassed a high needs SEND deficit of 7.5 million that must be carried forward to be recovered across the next 5 years. That figure, Chairman, would have been 5.6 million, or 43% higher, had this council not utilised the powers that unfortunately are no longer available to us to offset the overspend in previous years. Whilst I welcome the additional investment in high needs SEND in 2021 and 21-22, it is simply too little too late to address the chronic shortfalls in funding in the last few years, where we will now face the challenge of recovering that shortfall from future years through planned underspending against our future grant allocations. The schools and children of tomorrow will pay the price for a piece of legislation that totally underestimated the cost implications of the reforms it introduced, and for a government that was simply too slow to react to provide the necessary funding to meet the needs of these children and their families that their legislation was targeting. With that, Chairman, I second the recommendations as set out in the report.
Thank you, Councillor Napier. Can I ask if there's anyone else wishing to speak on this item, please? If not, the recommendations have been moved and seconded. If there's any dissent, please indicate through the chat function. Can I ask if the report is agreed, please?
Agreed, Chairman. Agreed.
Thank you. And there are no indications in the chat function, so I can confirm, therefore, that the report is agreed. So if we can then move on to item 6, Health Protection Assurance Annual Reports. If I can ask Amanda Healy, Director of Public Health, to present the report, please.
Thank you, Chair. This report is to update Cabinet and the public of our health protection assurance arrangements in County Durham, which is overseen by our Health Protection Assurance and Development Group. The report doesn't cover COVID-19 in depth, as that has been covered through regular updates to the Health Protection Assurance Board, the Health and Wellbeing Board, and has also been reported into scrutiny. However, what it does cover is assurance on the other key areas in relation to health protection, which include screening, immunisation, other communicable diseases, strategic regulation, and the preparedness in response to emergencies. The report outlines the multi-agency arrangements that need to be in place and how the Health Protection Assurance Development Group oversees those with input from other partners, including our CCG colleagues, Foundation Trust, NHS England, Public Health England, and other members of Durham County Council. Paragraph 15 identifies some of the changes that are and will be taking place in the forthcoming year, particularly in relation to Public Health England, where it was originally announced in August that that was going to be under a new organisation called the National Institute of Health Protection. That has now been renamed as the UK Health Security Agency, and some of public health functions, including the health protection functions, will transfer to this new agency during 2021. The health protection arrangements are set out in paragraphs 20 to 48 of the report, and these arrangements have continued during COVID, which I think has been really, really important. And the assurance arrangements set out how the development group oversees different plans and has those presented at the group. So, for example, plans around healthcare acquired infections or emergency preparedness, and they're all detailed in the report. From paragraphs 49 to 91, there's an update on each of those areas, and there's a more detailed scorecard which is provided in the appendix. I think I'm really pleased to say that we have seen over the year, particularly during the year of a pandemic, continued high uptake of our immunisation programmes, particularly our childhood immunisation programmes. So, for example, 96.8% of measles, mumps and rubella for our 2-year-olds at this time. We've also seen an extension of our seasonal flu immunisation programme to all council staff, but also a really high uptake, which will be evaluated and reported separately on across our eligible populations. And we've also seen that our antenatal and newborn screening programmes have been able to continue during COVID. However, the report also identifies that some of our other screening programmes have seen an impact, and they are part of a catch-up programme, for example, breast screening, and this is an area that we'll be seeking further assurance during the course of the coming year. The report outlines some of our other communicable diseases, including sexually transmitted infections, where pleased to report that County Durham has rates lower than those at a national level. It also identifies some of the work of our infection prevention control nurses who are funded from the council but are employed through the CCG. They've really come to the fore during the COVID pandemic, particularly working with our care homes. However, they have also continued with some of their other day-to-day work overseeing healthcare acquired infections, which is really important. The section on strategic regulation, we have a very strong team within the Council's Community Protection Service of environmental health officers who've worked both on COVID, but some of their existing work on outbreaks. However, they've also extended their work to now think about broader protection of our population, so making every adult matter work, for example, in Horden, which has started to develop. And then finally, our preparation for emergencies through our Civil Contingencies Unit, which again, I think we have a very strong Civil Contingencies Unit in County Durham, which has, and you'll see in the report, huge amount of work during COVID. However, actually some of the work that the CCU had been doing has stood us in good stead, including the production of an excess deaths framework and work on winter pressures. Finally, there's a little bit then in terms of my own development as a Director of Public Health to ensure that I'm as competent as possible, so Gold Command training and annual updates on our the stack rota, the scientific technical advice cell rota from colleagues at Public Health England. So the report obviously brings to some conclusions in terms of the good communication across partner organisations and attendance at the Health Protection Assurance and Development Group, some good areas of development, but also some areas that require further assurance in this forthcoming year, particularly those areas of screening and in the adult population in particular. Chair, the recommendations are set out in paragraph 7 of the report, and several recommendations there, including the report to the continued need to understand as functions transfer to different organisations that we continue as a local authority to be assured of those health protection arrangements, and we will be feeding into the consultation on those changes, but also to continue to further identify and respond to any emerging health protection priorities as we continue our work on COVID and ensure that I update the authority appropriately. Thank you, Chair.
Thank you, Amanda. If we can then move on to the report and recommendations, can I invite Councillor Hobbles, please, to speak?
Thank you, Chairman. Health protection is a statutory function of the local authority. The Director of Public Health has updated Cabinet by the report on the arrangements that are in place to protect the health of our residents. The work relies on very good working relation arrangements with partners such as Public Health England, NHS England, as well as local GPs and environmental health officers. I am pleased to see there has been an increase in the uptake of the flu vaccine by all eligible groups and amongst local authority staff. Uptake of the flu vaccine has improved in all cohorts compared to the previous years. For example, 71.4% of people aged between 65 and over were vaccinated in 2019-20, which went up to 84.2% in 2021. The report shows there has been significant change in health protection structures and processes during the COVID-19 pandemic and highlights continued need for the heightened response to COVID-19 while seeking to manage change and maintain focus on the other health protection functions. I look forward to receiving further assurances in relation to flu and COVID-19 vaccination and the need for assurances on the transfer of the CCG and the PHE functions, including health protection, emergency response and screening and immunisation programmes. I am happy to propose the report this morning, Chair.
Thank you very much, Councillor Hobbles. If we can have a seconder to the report, Councillor Gunn.
Thank you, Chair. Yep, Councillor Alwyn Gunn, Cabinet Member for Children and Young People's Services. I'm really pleased to be able to speak to this report. Protecting the health of our residents is of the utmost importance, and it's wide-ranging as can be seen in the report. I'm really pleased to see that performances in County Durham across all childhood immunisation programmes exceed national standards and averages, and that the report provides broad assurance that effective processes are in place for each of the key strands of health protection activity. County Durham has retained an in-house team of infection prevention and control nurses, and since September 2020, the service has been extended to schools, providing for children with special educational needs to bolster their infection prevention and control support in County Durham. I'm happy to second this report, and I'm sure there'll be further discussion on the key health protection issues at the Health and Wellbeing Board. Thank you, Chair.
Thank you, Councillor Gunn. Can I ask if there's anyone else wishing to speak on this report? If not, the recommendations have been moved and seconded. Please, if you could indicate any dissent in the chat function. Can I ask if the report and recommendations are agreed?
Agreed.
Thank you. And there's no indications, so I can confirm therefore that the report is agreed. If we can then move to item 7 on the agenda, Workforce Strategy 2021 to 2023. If I can ask Paul Darby, Corporate Director of Resources, to present the report, please.
Thank you, Chair, and good morning, everybody. This report presents the proposed workforce strategy for the Council. The strategy provides a framework for how we'll shape the workforce for the future, working with our trade union colleagues and with managers and employees across the whole workforce, and is fully aligned to the corporate plan. The report provides an overview of the strategy which is attached to the report at Appendix 2. And as members will see, there are 4 key workforce ambitions and priorities that help frame the work that will be undertaken over the next couple of years. And these are summarised in paragraph 17 of the report. And just for members' reference, I would outline them as being planning for the future and refocusing our workforce, building leadership capacity, developing our workforce, and being a good employer. By adopting this strategy, it will help us continue to shape our response to the post-pandemic recovery. And the strategy recognises that the world is changing and that our workforce needs to change too. The strategy sets out how we'll achieve that change together, working with our trade union colleagues and with managers and employees across the whole organisation. Underpinning the strategy are the key themes of having a consistent corporate approach to workforce development, investing in leadership development, a focus on well-being and a focus on organisational development transformation across the coming years. The strategy has been subject to an equality impact assessment and a rural proof and impact assessment, and both these impact assessments demonstrate that the adoption of the strategy and the work programme that sits underneath the strategy will have a positive impact on these 2 important agendas. The recommendations which are to approve and adopt the strategy are set out at paragraph 6 to the report. Thank you, Chair.
Thank you, Paul. If we can now move to the report and recommendations, can I ask Councillor Andrea Patterson to speak, please?
Thank you, Chairman, and good morning, everyone. I'm Councillor Andrea Patterson, Cabinet Member for Corporate Services and Rural Issues. First of all, can I thank Paul and all of the officers involved for their hard work in bringing this report and strategy forward today. There's been a tremendous amount of work gone into it, and had it not been for the pandemic, we would have had this strategy before us last year. However, one of the few positives from COVID is the learning over the last 12 months, which has helped shape and refine this strategy further. The 4 key priorities outlined in the strategy and the detailed action plans that underpin them will provide a solid platform for the development of all of our workforce going forward. The policies and processes will help us as an organisation flourish and adapt to the changing world in which we live, and it will ensure that we continuously strive to be a good employer and that we continually invest in our people. I commend the officers for both the scale and the extent of these ambitious and far-reaching plans to create the workforce that we need for the future. It covers things such as our investment in apprenticeships, our leadership and management development, right through to cultural change and succession planning. The single biggest asset we have as a council chair is our workforce, and this strategy supports all employees, regardless of their role, right from the bottom to the top. Our workforce has they've proved time and time again over many years, and particularly so in the last 12 months, how dedicated, how hard working and how adaptable they are, and I truly thank all of them for their continued hard work. Central to the strategy and the effective delivery of the various projects and programmes of work that will underpin it is the Tripartite partnership agreement that we have between officers, the trade union representatives and the elected members. These arrangements have stood us in good stead as we face the many challenges that have presented themselves over the last decade. And without these arrangements and the trust and the investment in our workforce, and without the support of the trade unions over many, many years, we would never have achieved the things that we've been able to achieve to date. Chair might add that the arrangements that we have in place here and the excellent employee relations we enjoy here in Durham are no small part due to the role of Councillors Napier and Councillor Stevens over many years. Their wisdom and guidance have proved invaluable, and I'd like to both recognise their efforts in this regard and thank them both for their hard work over many years. They leave us in an incredibly strong position as they step down from the council at the forthcoming elections. I believe this strategy will help provide the necessary focus and prioritisation for the development of our workforce going forward, and I particularly welcome the rural impact assessment that's been undertaken, which demonstrates that the actions set out in the workforce strategy will make a positive contribution in tackling the inequalities brought about by the challenges that we face as a predominantly rural county. With that, Chair, I'd like to move the recommendations as set out in the report. Thank you.
Thank you, Councillor Patterson. If we could have a seconder to the report, please. Councillor Hovels.
Thank you, Chairman. Can I also thank the officers for the report? I'm particularly pleased to see the focus on well-being for our workforce, featuring within the strategy we are considering this today. As Councillor Patterson has rightly pointed out, our workforce are our biggest asset, and I am constantly impressed with the dedication and commitment, none more so than over this last 12 months, where we have had to adapt to different ways of working, and many of our teams have had to go above and beyond what they usually reasonably asked of them. I see this in my own community on a daily basis. This strategy will ensure the physical and mental well-being of our workforce is at the centre of our workforce planning, and for one, I wholeheartedly support the aspects of this strategy. With that, Chair, I formally second the recommendations which has been set out in this report, Chairman.
Thank you, Councillor Hovels. There are indications to speak from Councillors Allen and Surtees, so if I can ask Councillor Joy Allen to speak next, please.
Morning, Chair. I'm Joy Allen, the portfolio holder for Transformation, Culture and Tourism. I welcome this report. Thankfully, our council had the foresight to invest in our workforce and develop an ambitious transformation programme that saw the introduction of a new flexible ways of working that's led to employees having a better work-life balance, as well as enabling us to develop, retrain and attract employees. Our transformation programme has enabled our staff to work at a number of locations across the county, which has also reduced the need to travel back to one central location. With the benefit of hindsight, there's no doubt that this innovative programme has been one of the main reasons our response to COVID was so impressive. Our workforce was equipped with the relevant equipment and had access to modern technology that allowed them to work remotely and put in train effective business continuity arrangements that enabled them to continue to function and deliver vital services as close to the business as normal as possible. It's important that this investment in training, development and technology continues to enable our staff to do their jobs as close to our communities as possible. Thank you, Chair.
Thank you, Councillor Allen. Councillor Angela Surtees, please.
Oh, thank you, Chair. Councillor Angela Surtees, Portfolio Lead for Social Inclusion. I would like to thank my colleague Councillor Patterson and the officers for bringing this report forward. We do have a very wide and diverse workforce, and we need to ensure that all voices are heard and accounted for, and that everyone has the same opportunities to progress. I welcome the proposals set out in the strategy and the work that has been and will be done to embrace the diversity in our workforce. That will ensure that we continue to promote Durham as an equal opportunities employer and an employer of choice for all people from all backgrounds. We do a lot of work with Stonewall. We've adopted charters from the GMB around domestic abuse. We have staff networks. We've also got a disability leader award. We also have disability passports. So from me, in terms of looking at the whole equality and protected characteristics, we absolutely have this threaded right the way through the workforce strategy. I really welcome this report and I support the proposals as outlined, Chair. Thank you very much.
Thank you very much, Councillor Surtees. There are no other indications from people who want to speak. So if we can turn to the report and recommendations. Again, if there's any dissent, please indicate through the chat function. Can I ask if the recommendations are agreed, please?
Agreed.
Agreed.
Thank you. And there are no indications, so I can confirm, therefore, that the report is agreed. That completes the agenda items for this morning's Cabinet meeting. I've not been notified of any other business under item 8. However, before we close, and as we've already heard, this is the last Cabinet meeting for a number of Cabinet members who will be standing down as councillors in May. And I would like to recognise the huge contributions made by Councillor Alan Napier, Councillor Brian Stevens, both of whom led authorities prior to unification in April 2009, as well as Councillor Joy Allen. I hope you can all look back on your time working on the Council's Cabinet with great pride, and on behalf of myself and all Cabinet members, can I say thank you for your dedication and commitment, and wish you all the best for the future. With that, thank you. With that, can I thank everyone for taking part this morning, and to those members of the public and media who have watched this meeting, and I formally close the meeting. Thank you.